This meeting is being recorded.
A very warm good evening to one and all. Welcome back to the today's session. Today we have our guest speaker, Dr. Archana Sonawane ma'am. So today's topic will be depression and its homeopathy management. We welcome you, ma'am. We welcome you all the participants. So over to you, ma'am. Yes, ma'am. Kindly start the session, ma'am.
Okay. Now today's topic is depression and its homeopathic management. Myself, Dr. Archana Sonawane. We start our topic. Let it just the small introduction about the depression. So depression can be happen to anyone, that is any of a gender. Then people who have some difficult events, any abuse or severe losses, stressful events, they prone towards the depression. Women are more prone than the man. It can be result from to lead to problems at school and at work. So it can be started by some any situations we gives the negative impact in the school level or at work level. The depression episodes can be start. Although there are known effective treatments for mental disorders, more than 75% of people in low and middle income countries receive no treatment. Barriers of effective care include a lack of investment in mental health care, lack of trained healthcare providers, and social stigma associates with the depressive disorder. So mainly it is a social stigma that person is not taking proper treatment here. Again, the lack of less investment in the mental health care in the national levels, and no trained healthcare person roundabout is also the leading cause that most of the people stay away from the taking treatment. Now our objective of today's webinar, it is to learn about the depression and its prevention, and we should learn or understand the homeopathic management. The definition, the depression disorder, also known as a depression, only depression or a massive depressive disorders or depressive disorder, these are the different terms it can be known. It is very common and serious mental disorder. It involves a depressed mood or a loss of pleasure or interest in activities for long periods of a time. Depression is different from regular mood changes and feeling about everyday life. It can affect all aspects of life, including relationship with family, friends, and community. To be diagnosed with depression, symptoms should be last at least for 2 weeks. So when we learn the definition, we must remember that it is different from a regular mental disorders or a mood disorder. In the depression, your symptoms should be regularly present every day, at least for 2 weeks. The prevalence, depression is a prevalent mental condition impacting about 218 million people worldwide. So 3.8% people in the world already have impacted because of a depression. It's a common cause of a disability in the United States, especially among the people under the age of 44 years, and it is a leading cause of a suicide. So it is more prone in a developed country in a more severe form. Suicidal tendencies, it is a severe form of a depression. Postpartum depression impacts 1 in 7 new mothers. Lifetime prevalence estimates vary widely from 3% in Japan to 17% in India, with most countries falling within 8 to 12% of the range. So depression can be categorized, or it should be present in the low developed countries or a high developed countries. Demographic dynamics. Gender, women are about twice as likely to experience depression as men. with a higher prevalence of a major depressive episode. It is 10.3% versus 6.2% in the US. Then people are more likely to experience in the third decade of the year, and the second peak, it should be in the between the 15 to 16 years of the old age than the adults. Okay. Then geographic depression rates are higher in the Middle East, North Africa, South Asia, and the United States compared with the other regions. Etiology, then we should know that it should be a complex male of a different etiological factors which leads to the depression. Some of the factors including biological factors, genetics, family histories, and genetic predisposition can play an important role. Neurochemistry, imbalance in neurotransmitters like serotonin, dopamine, or norepinephrine can contribute to depression. These are the happy hormones, and when they disturb, lead towards the sad moods. Hormonal changes, hormonal fluctuations such as those experienced during pregnancy or menopause can contribute to the depression. So hormonal fluctuations are more seen in the woman's life in the puberty, after marriage, delivery, and menopause. And these high rates of hormonal fluctuations leads the more percentage of women towards the depression. Other factors, psychological factors, it is a trauma. Experiencing traumatic events such as abuse or a loss can increase risk of a depression. Stress, chronic stress, whether due to work, relationship, or other factors, can contribute to the depression. So any excess or even relationship loss, job loss, any substance abuse, even emotional abuse by someone, it is also the traumatic conditions leads towards the depressions. Any workload, maladjustment in the relationship also leads towards the depression. Some are the personality traits. Certain personality traits such as a low esteem, perfectionism can increase the risk of the depression. So person who is not have a complete confidence in themselves, or some people, they constantly want to be a perfect, and when they can't achieve that perfectness, they may lead towards the depression. Okay, here is the social isolation. Lack of a social support and connection can contribute to the depression. So as you everybody knows, human is a social animal. So mixing in the society, making contact and communication in the society, having support from the other people is very important to prevent the depression. Or if it is a lack of social support, it may leads towards the depression. Life events, significant life changes such as a job loss or a divorce can trigger the depression. Substance abuse can contribute to or exacerbate the depressions. And some other factors like the medical conditions, certain medical conditions such as a chronic pain or a sleep disorders can increase the risk of depression. Medication, some medications such as those used to treat the hypertension, cancer can contribute to the depression. So these are the drugs adverse effects may lead to the depression. Or inflectual habits. So your eating and sleep habits, they are not in a regular routine, they may lead towards the depression. These are the some symptoms contribute in the diagnosis of depression. We can make a list of the symptoms. A depressive episode is different from the regular mood fluctuations. They last most of the day, nearly every day for at least 2 weeks. Okay, so this is the most common criteria in the symptoms of depression, that symptoms should be at least for 2 weeks, and it should be nearly for a whole day and every day. Okay, then a depressed mood, feeling sad, irritable, empty, they may feel a loss of pleasure and interest in activities. So person who is very interested in some activities, he now become indifferent towards that particular activity or their particular hobbies. In a depressed condition, this can be a symptom. Then poor concentration, feelings of excessive guilt or low self-worth, hopelessness about the future, thoughts about dying or suicide, disturbed sleep, changes in appetite or weight loss, feeling very tired or low in energy. So sleep patterns are disturbed. It may be complete sleeplessness to the excess of sleep. Again, the appetite may be complete loss of appetite or patient want to eat more. So it is a wide range of symptoms we can observe in the depression. Now, DSM-5, these are diagnostic criteria. It is the Diagnostic Statistical Manual by the American Psychological Association. And according to this DSM-5, they listed 9 major symptoms. And out of these 9, at least 5 symptoms should be present for persistently present for the 2 weeks to diagnose the depression. And this is the list of the symptoms: depressed mood, markedly diminished interest or a pleasure, significant weight loss, insomnia or hypersomnia, psychomotor agitations or retardation, fatigue or a loss of energy, feeling of worthlessness, diminished ability of a thinking, recurrent thoughts of death. So out of these 9 symptoms, at least 5 symptoms should be present persistently for 2 weeks, diagnose the depression. Okay. Then we come towards the another classification. It is the ICD-10 diagnostic criteria. Now in our third year CBDC syllabus, this ICD-11 is introduced in the case taking proform of Organon for the disease classification. So I include this slide here for the depression also. So ICD, it is the International Classification of Disease, and 11, it is the revised 11th time, and it is also followed by the WHO and most of the other countries. And it should gather some group of symptoms and give the types of depressions, or we can say a classification of depression in the different headings like adjustment disorder, bipolar or related disorders. And these are again in the brackets are written the codes for the particular disorders: single episode depressive disorder and recurrent depressive disorder. These are according to the ICD-11. And there are, because ICD-11 is very recently introduced, and before that depression ICD-10 codes are is in the lower side we are written. You can read this slide very well. So this is again newly introduced part in the CBDC, that we should write down the classification of disease according to the ICD-11. Now we come toward the prevention. So everyone knows prevention is better than the cure. Prevention programs have been shown to reduce the depression. Effective community approaches to prevent depression include school-based programs to enhance a pattern of positive coping in children and adults. So this is most important thing, that at the school level or at the college level, we should give the problem-based learning to the students and adults to cope up positively with the life situations. Interventions for parents of a children with behavioral problems may reduce parental depressive symptoms and improve outcomes for their children. So the parents whose children are mentally having any problems, they should be having some psychological educations, some counseling programs, so they can cope up and handle their children without leading towards the depression. Exercise programs are very important for the old persons. So regular exercise, it may be yoga, pranayam, simple walking, it is mostly effective to prevent the depression. Self-care. Self-care role is very important in the depression. So how we can take a self-care? Try to keep doing activities you are used to enjoy. The person who is interested in activities, they should be continuously done. Stay connected to friends and family. So we always make our contact and connections with the family and friends. exercise regularly, even if it is just a short walk. So daily habit of exercise. Stick to regular eating and sleeping habits as much as possible to avoid the disturbances in sleep and eating appetite pattern, which leads towards the depression. Our eating and sleeping habit must be regular one. Avoid or cut down on alcohol and doesn't use illicit drugs which can make depression worse. Talk to someone you trust about your feelings. So always share our feelings with the trustworthy person. It may be parents, friends, or much close relatives, but we try to make contacts. Talk to someone is very important as a self-care. Seek help from a healthcare provider if you have thoughts of a suicide. This is the most important thing, that you should ask help to the nearer one. When remember you are not alone and that many people have gone through that, you are experiencing and found help. Talk to someone you trust about now you feel. Talk to a health worker such as a doctor or counselor. Join a support group. Okay, if you think that you are needing a immediate help, so contact immediately to the emergency services which contact you and provide the help. So self care is very important. Always try to keep ourselves positive and engage in the activities which make us happy. When we come towards the treatment part here, there are effective psychological treatments for depression, which includes the behavioral activation. And behavioral activation is nothing but keep engaged ourselves in the activities which gives us the pleasure and happiness. Cognitive behavioral therapy, it try to change the thought of a person, which leads to the change in activities or actions. Interpersonal therapy, it leads to improve the relationships and improve the mood of the person. Problem solving therapies, it is help to identify the problem, analyze the problem, and after this it very easy to solve the problem. Psychoeducation, there are the different therapies, again include talk therapies is also included, etc. Then reducing stress and strengthening social support. Again, try to join the communities which are similar to your feelings. It's also helpful in the depression. Promoting functioning in daily activities and community life. So our daily activities should be promoted and it should be maintained regularly with a social life. Some antidepressant can be used in the treatment of depression. WHO response. WHO's Mental Health Action Plan 2030 to 2030 highlight the step required here, that is interventions people with a mental disorder including depression and self-harm suicide are among the priority conditions covered by WHO mental health cap action program. So WHO arranged some programs and we must take help of such programs. Even WHO write some manuals. Okay, so here is the problem management plus manual, or it should be a group interpersonal therapy, depression manual, thinking health manual. They can easily available by WHO and we can take help. They gives the supportive treatment and ideas. Psychological intervention manuals is also include for the depression. So WHO support for the prevention and treatment of a depression. Comorbidities. Depression can come along with a post-traumatic stress disorder, obsessive compulsive disorder, panic disorder, social phobias, generalized anxiety disorders, other medical illnesses, heart attack, stroke, HIV, AIDS, Parkinson diseases. So these are the different conditions they may associate with the depression. Now we come towards the homeopathic management here. Homeopathy offers a very safe and gentle treatment for the depression. So many cases of depression. Homeopathic treatments for depression provide a natural and individualized approach to managing symptoms by selecting remedies with aligned with a person's emotional state and overall constitution. Homeopathy aims to promote healing and restore mental health. So, individualization, every person have their own individualized approach, and selection of a remedy on a constitution and totality is the main approach of homeopathy. The main objective of homeopathy in depression cases is not merely giving symptomatic relief but to effect a cure, that is the holistic approach. Homeopathy is helpful both for acute as well as the chronic cases of a depression. In mild to moderate forms of a depression, there are high chances to recovery with homeopathic medicines, but in some severe cases, help of other schools of medicines are required. So this categorization of mild, moderate, and severe depression, it depends upon the severity of the symptoms and number of symptoms and frequency of the symptoms. These all together, when comes together, we can easily categorize the mild depression, moderate depression, or the severe depression. Severe depression, they also comes with a different pattern, that is a single episode or recurrent episode. Single episode, it is the first or a only one time episode. Recurrent episodes, this is the at least two episodes. It gives the history of two episodes in the life. And another one is the bipolar disorder. It includes the depressive episodes alternate with other manic symptoms, other behavioral symptoms. Now, this is the homeopathic. This is classification of the mental disorders as per the aphorism 210 to 230. Somatopsychic, acute emotions, doubtful origin, and psychosomatic illness. These are the four types of the classification or types of mental disorders according to the Hahnemannian classification. And when we collect the symptoms after the case taking, we categorize the symptoms and try to classify under these headings. Okay, so this is the homeopathic. This is classification used for the mental disorders, including depression. Now, this is the actual management given by the Hahnemann, which is again extremely similar with the modern medicine as per the 26 and 27 aphorism, display of a confidence. So we should try to encourage the person, increase the self-esteem and give the confidence is again important thing here. A well-distinguished dispassion, friendly exhaustion. So social communication is again very important that Hahnemann told here. Sensible advice, avoid corporal punishment. Till today, some other mental asylums, they gives corporal punishments and hunger diet to the mental disorders. And before 300 years, Hahnemann gives this sorted treatment for the mental disorders, and this is very useful in the depression cases with the auxiliary mental regimen, and also some dietetic regimen is also helpful. Hahnemann also give the importance to the diet and regimen. So banana like substances which increase the serotonin level, that is the happy mood, so they should be introduced or include in our day-to-day diet. Some homeopathic drugs are here. So Ignatia can be the topmost one. It is with the acute conditions. It should be depression, a loved one, broken relationship, disappointment, excessive weakness, and it also excellently treated in the bipolar disorders. Another drug is the natramure, which used in the chronic depression. The person is very sensitive and sad, and patient don't like consolations, and women before their periods who have the depression or a depressive attack, natramure become the more useful drug. Another one is a Aurangabad, which comes with a suicidal thoughts, hopelessness. They feel life is a burden and it is useless to live. Next drug, it is a Kali Phos. Here the peoples are more overstressed, have much of a worry about so many things. They constantly sad and gloomy, feel mentally and physically exhausted, anxiety attacks and spells of weeping, and they have sleeplessness. Another drug is important here is the sepia. It is more commonly become useful in the women during the menopause, with a great aversion to seeing family members, loss of interest in doing the things which are maybe more happy to her. So indifferent feeling is the again very key symptom of a sepia. Very irritable and get offended. Semicifuga racemosa. Again, it is depression among the woman being after the birth. This is the postpartum depression. It is feel exhausted with the symptoms. Then symptoms coming with excessive talkativeness, indifferent behavior, fear of death, fear of going mentally insane. All these symptoms come under the semicifuga racemosa. Now, this is the assessment tools used for the diagnosis and severity of a depression. Beck's depression inventory, Hamilton's depression rating scale, and Jim's self-rating depression scale. These are the type of questionnaires we should ask to fill by the person or a patient, and we can try to find out the severity of a depression and categorize the person into mild, moderate, or severe category. And again, this is helpful in the follow-up cases after our intervention, whether depression is decreased or not, we can assist with these tools. These are basically the different questionnaires. These are free, these are easy to handle. Okay, now thank you. So never lose today's happiness by thinking about yesterday's pain or tomorrow's sorrow. So thanks everyone. I want to give my thanks to the organizer team, supportive team, and technical team. Yesterday, because of some technical problem, we can't conduct this webinar, but because of you, this is possible today. So thank you, ma'am. So any question or any queries?
If anybody has any doubt, please ask. The lecture was very nice and it was very insightful. So everything like about depression, its management was explained very nicely, and the concept was very clearly understood. Thank you so much, ma'am.
Thank you. Okay, can we leave?